Did you know the largest organ in our body? It's our skin. It's true. It's also, though, the biggest source of embarrassment for our next guest, whose mysterious skin condition has left her hiding it away from everybody that she knows.
Since I can remember, I have red dots all over from my whole leg down. And then on my arms, it's just a reddish color with bumps on it that's kind of always there. It used to not bother me when I was little. It was just something that I had. But when I got in high school and people started pointing out, I got really self-conscious about it. I used makeup a lot to try and cover it up. And I tried everything. I would try home remedies like coconut oil, a bunch of different lotions. I've tried scrubbing them off, exfoliating. I went to a couple dermatologists. They gave me creams and stuff to try. None of it made a bit of difference. I can't wear a dress and feel beautiful because I'm self-conscious that somebody's gonna touch my arm or somebody's gonna see my legs. The biggest frustration for me is just nobody knows what it is. I just really wanna know if there's anything I can do to fix this or make it any better. I'm at Dr. Batra's office. She's gonna look at my arms and shoulders and hopefully tell me what I can do to make it better.
Do you have a tendency towards any allergies or asthma or any kind of other skin rashes? Have you ever had other allergic issues at all, anything like that?
No, ma'am.
We'll put you in an exam chair, and I'm just gonna pop on a pair of gloves and I'll take a look. Now, do you ever get little pimples or pustules, or is it mostly kind of fine like this?
Mostly fine like that.
And it actually even extends all the way down to the bottom of the arm. Okay. And then I'm just going to take a look at your legs.
Okay.
The lower legs, it's really more the redness. Is this anywhere else other than the arms and legs? Do you notice it on your back or your chest or anything?
No, ma'am, just my arms and legs.
So the good news is I have some ideas.
Okay.
And what I'd like to do is talk about some really excellent treatment options that I think you're gonna like.
Okay, awesome.
Just a few days from that doctor visit, Ondrea and Dr. Batra join us, and I know you are anxious for some answers.
I am.
And the question is, do we have some answers, Dr. Batra?
So we do. This is actually a really extensive case of keratosis pilaris, which is kind of a heaping up of extra keratin protein in the follicle, or kind of in the outflow tract of the follicle. It's incredibly common, but I think Ondrea's case is just much, much more extensive than we usually see. There's extra protein heaping up and kind of blocking the outflow tract of the hair follicle. And it's really common, but people don't realize it even has a name or that it's a medical condition. But I think in Ondrea's case, the much more cosmetically, problematic part that makes you so self-conscious is that when the keratin sort of plugs the follicle, that it also causes inflammation. And so that's what's causing all of this redness. And so there's sort of a vascular component or a redness component to it as well. So when we talk about treatments for this, there are treatments, and hopefully much more effective than some of the ones you've tried. Right. Because what we're trying to do is really turn over the skin and exfoliate it and get those keratin plugs to come out. Now, the downside is it's not a curable condition. It's not something that I could give you and it's going to go away. But there's some very effective things, because it's genetic, that maintain it so that it becomes much less noticeable and problematic for you. And also, the good news is it tends to get much better as you get older in many people anyway. Okay. So you're still young, you still have time for it to get much better. But as I said, what I was going to do for you is start out with some really good cell turnover agents, including a prescription-strength vitamin A, as well as a prescription-strength cream with urea that's an exfoliant that's meant to turn over the skin. Okay. And then because the redness has been a big component of this, there's actually a newer product that's a gel that constricts blood vessels that more temporarily, like if you have a job interview or a date or something really important, you can put on to make those blood vessels clamp down so that the redness isn't as much of a problem. And then in the longer term, there are lasers that help with the redness, which are vascular lasers like the V-beam laser. And so
I'm hearing a lot of hope here.
Oh, yeah.
Maybe not like a 100%, hey, this is gone forever, but to the point where with all these treatments, really, people should no longer look at Ondrea and be like, oh my gosh, what is that? It's really gonna fade, right?
Well, it should feel much smoother, and then the other treatments like the laser and the gel I was mentioning will make it look much less red.
And I have a little surprise. We actually reached out to Dr. Jaffe and the team at River Chase Dermatology and Cosmetic Surgery in your hometown of Naples, Florida, and they've agreed to provide you with 6 of those V-beam treatments that Dr. Batra recommends for free.
Wow.
So thank you for sharing, and hopefully you're on your way to some clearer skin. Dr. Batra, always a pleasure.